All right, good afternoon, and welcome to our virtual fireside conversation on mentally healthy workplaces in dynamically changing landscapes. I'm Marion, Chua, the Director of Mental Health and Research here at Comcare, and I'll be your facilitator today. Now, whether you're joining us from a busy work site, a quiet office, or somewhere in between, thank you for making the time out of your busy schedules this afternoon to be here. So before we begin, I'd like to take a moment to acknowledge the traditional owners of the lands on which we are virtually meeting from today. I'm joining you from Melbourne, which is the land of the Wurundjeri Woi Wurrung and Boonwurrung peoples, who are the traditional custodians of this land. I would like to pay my respect to their elders past and present and acknowledge and honour the unbroken contribution they have made and continue to make. I also extend that respect to other Indigenous Australians and Torres Strait Islander people who are present on this call today. So every October, I should say, is Safe Work Month, and the theme this year is Safety Every Job, Every Day. Tomorrow is also World Mental Health Day, and this year's theme is Connect with Your Community. Comcare is hosting a total of 4 webinars, and I encourage you, if you haven't already, to register if you're interested. The details of them are on the screen. So this is a timely conversation to have as the first webinar for the month, and I am incredibly honoured to welcome our special guest for the discussion today, Georgie Harman. Georgie Harman AO is one of Australia's most influential and trusted figures in the mental health sector. As the CEO of Beyond Blue, she believes passionately in doing better for people in communities affected by mental health issues and suicide. Like for most of us, it's personal. Georgie has steered Beyond Blue through significant change, expanding its services and supports, strengthening advocacy and community connection, and harnessing digital innovation. She is the Deputy Chair of the Australian National Advisory Council on Alcohol and Other Drugs and serves on the board of mentoring organisation Kilfin in Australia. She is a patron of Out for Australia, and was an inaugural board member of the Victorian Pride Centre, the first purpose-built place for Australia's LGBTIQ plus communities. Please join me in welcoming Georgie. Thank you, Georgie, for joining us.
Hey, Marion, lovely to see you again.
Wonderful. Well, today we are going to be talking about mentally healthy workplaces in dynamically changing landscapes. And if you experience any discomfort or distress at any point during the next hour or so, please reach out to a trusted person, your EAP provider, or Beyond Blue. There are some links and contact details in the pinned post. So I think it's worthwhile us actually talking about what do we actually mean by dynamically changing landscapes. And first of all, I think it's important to acknowledge that there are many factors that contribute to the changing landscape and the impact that in isolation each of them have, but also how they interact and overlap each other. And we know, Georgie, we can't cover them all today, unfortunately, but we will delve into a handful of some of these, including human and social factors, AI and technology, and geopolitical impacts. Now, throughout the discussion, you might notice that we will also answer some of the questions that came through from the registration. So thank you ahead of time for those that have submitted them. We will also have time to answer your live questions. So please use the Q&A function throughout the conversation. So before we get into the questions, Georgie, I just wanted to share some recent trends and data around mental health and psychological injury in the Comcare scheme. Our findings are also consistent with what the social sciences are showing across the country. Now, across all Commonwealth jurisdictions nationally, we are seeing a pattern of increased numbers of claims for psychological injury, and the Comcare scheme is no exception. Psychological injuries, you can see there, their claims are at a 10-year high across the Commonwealth. These claims now account for 53% of overall claims costs, with longer periods of incapacity as a result of poor return to work rates. The average cost of a psychological injury claim is currently $370,000, and that's about 4 times the average for a physical injury or a disease claim. Mental health conditions are now the most prevalent type of workers' compensation claims in the Commonwealth, and they are just continuing their upward trajectory in terms of their numbers and also the proportion within the Australian government sector. What do we mean by that is that 44% of all claims received in 24-25 financial year were as a result of psychological injuries. 34% of those claims are accepted, and as of the 30th of June 2025, 42% of those open claims, 42% are still open claims. These numbers are all up by about 3% compared to the same time last year. We also see, in terms of return to work rates, poor outcomes. So, for example, in 2024-2025, the return to work rate was 53% in comparison to 93% for a physical injury. The national data, also from Safe Work Australia, estimates that unplanned absences due to medical health cost organisations more than $10 billion a year. So, Georgie, these figures are clearly showing that psychological injury is not only rising in prevalence, but in complexity and cost, and the trends that we're seeing across the Comcare scheme mirror broader national patterns. And they raise some important questions around how we respond. But I'm curious to know, what's your perspective? Is the data that you are seeing and the conversations that you're having reflective of this growing complexity?
Look, absolutely. And I think, whilst we're obviously talking about the context and setting of workplaces today, we can't ignore the fact that we have lives outside of work and we bring those experiences into our workplace as well. So if we zoom out and we look at what's actually happening in the lives of Australians across the country today, it's big, right? Look at these numbers. So this slide really just shows at a macro population level what the state of the nation is in terms of our experiences of really common mental health conditions like anxiety and depression, but also experiences of suicide. So we lose 9 Australians to suicide every single day. That is a shocking number. It gives me, tingles every time I talk about it. But these are numbers, but behind each of these numbers, there's people, and there's workplaces, there's communities, there's families. So the ripple effects are profound. What we're seeing in all of our services and in all of the presentations to those services and in our conversations with the community is that life feels hard and heavy right now. And that the complexity of people's experiences are really reflecting the complexity of life and the compounding issues that people are experiencing. So they're not presenting to Beyond Blue with just a single issue anymore. It's multiple issues that are really affecting their mental health and well-being. We do some really deep research on population trends when it comes to mental health and well-being. And if we can just go to the next slide, this is some of the data from our latest national research. This is a very, very representative study that we do in partnership with the ANU Social Research Centre every couple of years. So we actually are able to measure trends over time. And this is a really, as I said, a very reliable pulse check of what's going on for people. So we talked to about 5,000 people, again, a representative sample, about the common causes of distress in the last 12 months and how they have actually supported their own mental health, but also their help-seeking behaviours, the causes of distress, et cetera, et cetera. What we found is that so many people are experiencing really high levels of distress for years before they access support. And as some people wait up to a decade, not actually understanding that there's that actually there's support out there, and this thing is called anxiety or depression, or both. What we also found, and this was really concerning, was that nearly half of Australians who sought support in the last 12 months, professional support, only did so when they were already either very distressed or extremely distressed. So they're waiting until they're really quite crook until they're taking that step towards support. And that really just all ladders up to where Beyond Blue's playing these days, which is in helping people to get support earlier. We don't want people to be struggling for years and decades. We want to get them into support sooner so they feel better sooner, so they get well and they stay well. The other major finding of this research was that how persistent stigma and shame are. And more than 1 in 5 Australians, and that's up from 13% just 2 years ago. So a really significant increase. So 1 in 5 said they felt embarrassed or ashamed to seek support. And 1 in 3, and again, that's quite a significant rise from 2 years ago, said they felt their problems weren't serious enough to justify seeking support. So again, some very concerning trends, and the role of workplaces in terms of supporting and catching people early is really important. In terms of, we can go to the next slide, what's causing the most psychological distress? Almost half of people said that financial pressure was the main driver of their psychological distress. 1 in 5 described the negative mental health impacts of cost of living pressures as extreme. Behind money worries, 1 in 3 people experiencing distress from relationships and housing affordability. For 1 in 5 Australians, this is actually interfering with their day-to-day lives. So this is not an insignificant issue. So we have this data that really sketches out how complex it is right now for people, the various causes of distress, but also some of the barriers, and how, if we can go to the next slide, people are managing multiple stressors. So, and as those stressors increase, their mental health experiences and challenges increase. So 4 in 10 people reported anxiety when faced with 1 or 2 distressing events. But for those who live through 5 or more common distressors, life stressors, this jumped to more than 8 in 10 people. So this layering effect is really coming through in our population research. And these are people's lives, and these are people's experiences that they're bringing into the workplace right now.
Thanks, Georgie. And I think it's important to acknowledge that, as you mentioned, that even though the survey was conducted in the community, our workplaces are representative of our community. And so we really can't separate or turn a blind eye to these numbers and what we're seeing and hearing as well.
Yeah.
So I think we might, on that note, it's worthwhile that we probably start with our first topic of discussion around economic climate and social factors. It seems timely that while talking about financial pressures, to also acknowledge the current landscape. And so you talked about compounding issues. And so we're thinking about rising interest rates, cost of living, and the housing crisis. These are realities that many of us are facing and grappling with. And then if you layer that with the ongoing ripple effects of post-COVID society, where there is that declining sense of community, there are changes to retirement expectations, with perhaps individuals having to work longer, and then the dynamics of a multi-general workforce. And so these complex sets of challenges are being felt across the board. They're affecting the community indiscriminately and are notably quite unprecedented as well. And so we know, as I said before, these pressures don't stay at the door when we come to work, and they naturally influence our well-being and inevitably show up in our workplaces too. We saw, and perhaps some of us may have experienced this during COVID, how the shared experience paved the way for more candid conversations around mental health. And I wonder, Georgie, do you think this cost of living crisis is perhaps becoming a similar leveler for those conversations?
Yeah, look, I think it is. I think in both kind of positive and negative ways. I think I've talked a lot since the pandemic around how our relationship with work has shifted, how expectations of employers have shifted, and a lot of us have recalibrated some of our, the norms that we perhaps have lived and worked with for a long time. There's been no clean snapback, as former politicians talk about, and some bosses would want to have seen happen. And I think we are living through and working through a period of actual misalignment in terms of expectations from an employee perspective and an employer perspective. I think that's causing a lot of friction. In terms of cost of living, I mean, we hear a lot that actually the cost of a commute is often a real factor for people in terms of their a willingness to, spend more time in the office again. So, it is, and I think the higher you get up the ladder in terms of hierarchies at work, the less that feels real to you. This is a real experience of people who are struggling to make ends meet, to pay their rent, to put food on the table. And, they're having to curate and make choices about where they spend their income. And it is real. It is real. And I think, as managers, as people leaders, we absolutely need to remember this and be asking different types of questions at the moment. I think that the other thing around sort of money worries in workplaces is we have not had the same conversation about money worries as we have as a country around mental health worries. We've been talking, Beyond Blue's been talking about, shining a light on mental health and encouraging conversations about mental health and well-being and mental illness for 25 years. We've not had a similar conversation about the stigma and shame that people feel about money worries. So people are not as comfortable talking about this, which is weird, isn't it? I mean, it shows in one sense how far we have come when it comes to talking about mental health in workplaces, but talking about money in workplaces, I think we've got a long way to go. So we've got to make this link, though, because money and mental health are actually two sides of the same coin. At Beyond Blue, we've got a really amazing partnership with Financial Counselling Australia and the National Debt Helpline, and our support service and the National Debt Helpline work seamlessly together in terms of making sure that people have support on both sides of that coin. We've developed an online money and mental health quiz together with Financial Counselling Australia, which is one of our most used resources, one of our most used digital tools. You can find it on our website. More than 44%, we've had 16,000 people interact with that quiz in the last 12 months alone. And more than 44% of people, their results indicate that their financial well-being was in the struggling category. 30% of those 16,000 people, they were actually showing that they were in financial crisis. So there is a lot going on there for people. So yeah, I think Marion, the point you've made about the two cannot be disconnected, and we've got to start thinking about financial stressors in the workplace in ways that we haven't in the past.
Yeah, thanks, Georgie. And I think you make a really crucial point that in the climate that we're in, where we have perhaps workplaces who want to encourage people to return to the office, that we do have to think about the financial strain for some of those individuals and what that means and how that can play a part as well in being able to get to the office and making those choices as well. So I guess that this is great because this leads into our first core registrant question, which is around where hardship crosses the line into harm and how might we differentiate between harm and discomfort when it comes to workplace mental health?
Yeah, look, it's a great question. I was like, whoa, that's a good question. It really comes down to intensity and chronicity. So how serious is the harm and how long's it been going on? And I think it's really important, as the questioner has said, to draw out this distinction between discomfort and harm. Because we do not want to pathologize everyday emotions, very normal human emotions that we all experience in our workplaces. We all get bored in meetings. We all receive feedback from our bosses that we don't agree with and we don't like, and that makes us feel angry and frustrated and, upset. We've all had views that are differed from our colleagues from time to time. And I don't know about you, but I always feel stressed ahead of a deadline. I'm a last minute person, and that's not good. It's not good for my stress levels. So those aren't harms. They are natural, transient demands of our jobs. And we manage them through through coping strategies, through which might, for me, it's going home and talking to friends and family and my partner. It's taking a walk at lunchtime. It's getting enough sleep. It's the ways in which we can manage our well-being. Now, psychological harm, psychosocial harm in the workplace, on the other hand, refers to serious and sustained negative impacts of a workplace, workplace factors on someone's mental health, someone's psychological health. And they're linked to psychological hazards, which are aspects of work design, workplace culture, organizational interpersonal relationships, that can contribute to or lead to burnout, stress, anxiety, or other mental health issues. So bullying, harassment, discrimination, terribly toxic and terribly bad for our mental health. Excessive workloads that are consistently unrealistic and unrelenting. We all go through peaks and troughs in our workloads. I don't think I've seen any job that doesn't. But when those demands become excessive, unrelenting, and unrealistic, that is a harm. Lack of job clarity or job security, that can be terribly, harmful. Poor support from managers and workplaces more generally, and also exposure to traumatic events, which by the nature of some jobs are, they're just present, emergency services, for example, but it's how those workplaces actually buffer and support people through that exposure that really matters. So there is a distinction, and I think it's really important that we don't conflate those two things.
Yeah. And I think you also touch on the importance of good work design.
Yeah.
If we're looking at exposure to traumatic events or fatigue or job demands, and employers having responsibility to ensure that each role and each job does look at all those factors and how that might interplay.
Yeah, I was chatting to Professor Tony de la Montagne, who's I guess the godfather of workplace mental health in Australia. He's just extraordinary. And I was interviewing him for a podcast that I put out recently called Think Again. And Tony came up with a statistic that just blew me away. He said workplaces contribute to about 15% of adult depression in Australia. And if we can even reduce incrementally that percentage, just think about the population impacts. So if workplaces become more mentally healthy and shore people up and design work really well, it will release huge benefits from a social health perspective, from an economic perspective, from a productivity perspective, and from a human perspective. So, we talk about the workplace as a setting, but I think we sometimes don't realise what a huge opportunity it is if we get this right.
Yeah, absolutely. There's just a comment in the chat around the difference between perceived harm and actual harm. And it's about understanding the individual's perception of harm and what does harm mean for you or for me as well, and that understanding. And I think therein lies that opportunity to actually create some education around that and shared understanding.
And I think that, the definition of psychological safety in the workplace, psychological safety is not the absence of strain or stress. In fact, those are things that actually, in the right doses, contribute to our performance at work. It's got to be the right dosage.
Yeah, thank you. So I'm just going to shift now to our next topic, which is about technology and AI. And we're navigating now a digital landscape that's moving at lightning speed, and I would actually say a frightening speed. I would actually add that to that. So for many of us, it feels like they're sprinting to keep up, like I sometimes feel like I am, and others we know are already impacted through their jobs and through their livelihoods. We've seen a lot of changes post-COVID in terms of remote work arrangements. We know that it opens up new possibilities and flexibility, but it also comes hand in hand with challenges, particularly around isolation, visibility, and the opportunity for workplaces to provide early intervention support. We're also seeing AI continue to make waves as it evolves daily at an unregulated and unprecedented rate. And that creates a lot of excitement for some, but also instability and uncertainty in others. So these shifts in the landscape, they're redefining how we connect, how we communicate, and how we care for our mental health. And while there's, like I said earlier, there's opportunities, some feel perhaps slightly overwhelmed and displaced. I'm interested to hear, how do you see its influence on workplace mental health, both as something that can support mental health, or in terms of a new challenge?
Yeah, look, this is a really massive topic, isn't it? And it's one that I'm grappling with myself, to be honest. I think we all are, and I think if we're not honest about that, then we miss the opportunity to actually have a really good conversation about AI when it comes to workplace mental health. There's a cartoon that I've found that I think sort of encapsulates some of this. CEOs are all rushing towards AI, and you've got to have a plan. You've got to really be thinking through, how do we want to design and curate and intentionally implement AI in our workplace so that it works for, you know, uh, of course the company, and of course the business, and of course the reason that workplace exists for shareholders or community or customers or whatever that is. But really intentionally thinking through how we want to embrace AI and new technology, as opposed to just rushing in. Because I think it's like anything. If you do that upfront, thoughtful, curious, introspective, consultative design of any major change, you're always going to get a better result. So, we've all heard the statistics about AI, and Gen AI is the equivalent of the introduction of electricity. This is a massive transformation for us as a country, as a community, as a global community, as people. It's a revolution. We don't know enough, I think, at this stage to be really certain about what it does mean for workplace mental health. And I'm being very candid now. But at the end of the day, AI is a tool. The hammer does not hammer itself. And we have to make sure, again, through that intentional design and implementation design, that we've got the humans at the right place. So, we all are hearing and I think I'm experiencing it. We're experiencing it in our workplace, that Gen AI can free employees from repetitive tasks and help them focus on, higher level cognitive work. That can free up people to build stronger social connections at work, to design, to do that sort of more thoughtful work. That can potentially lead to greater job satisfaction and engagement. But again, when AI is thought about as a tool that augments rather than replaces human capabilities, the main challenge is really in its introduction. We know that there is a lot of skepticism, a lot of cynicism, a lot of fear out there, and I don't think we can and should dismiss that fear. Because at the end of the day, clear use cases for these kinds of technology are still being developed for a workplace context. The technology is moving so quickly. It's absolutely not static. The answers are still not always clear. But at the end of the day, this is here. It's going to transform work. And the potential benefits can be enormous if we get it right. But we've got to support our people through it. We cannot dismiss these fears and these concerns about what this is going to mean for me and my job. We have to take that seriously.
But it's quite clear that technology brings both promise but also complexity in terms of its implementation. And what you've touched on is actually it leads into a question that's just coming through our Q&A around the potential role of AI, such as ChatGPT, in providing psychological supports in an accessible and an anonymous way. Is that a potential that you do see it heading into, Georgie?
Yeah, look, it's already here. We know that the number one use case globally for Gen AI is companionship. It's here, it's happening. People are turning to chatbots, to technology for psychological support. And in a sense, you can't blame them in the absence of anything else, if it's a wait list or if it's a queue or if it's an affordability issue. So we really need to be thinking about this very rapidly in terms of regulation, in my view. As a country, we know enough to be able to start to regulate these technologies when it comes to their application in a mental health context. We have all heard about or read about incredibly concerning cases where, AI has encouraged people to and actually given them the instructions to kill themselves. There are cases, legal cases starting to emerge around this. So it's about ensuring that we are using these technologies in safe, well-regulated and supportive ways. So, for example, Beyond Blue uses a lot of AI in the back end, and we're creating and curating online spaces for people where people can use technology to receive safe, moderated mental health support in online spaces. The Beyond Blue web chat service, the Beyond Blue forums. There are great spaces out there that use these new technologies that keep people safe, connected, and they're highly therapeutic. But we need that. We need good governance around safety standards, and we need to see that, I think, pretty quickly.
Yeah, it's certainly a powerful enabler, but it requires us to be intentional about how we use it.
Sorry, Marion, the other thing that I should add is that, as this machine learning's developing, if you think about it, the whole point of a therapeutic relationship in a mental health context is, for example, cognitive behavioral therapy. Your therapist challenges your thinking, challenges your thought processes, challenges how you feel about yourself. At the moment, the machines are not doing that. They're incredibly sycophantic. They actually affirm a lot of what we put into them. So again, I think it's really important that we are very cognizant of this and are putting the right regulatory and governance supports around these tools.
Yeah, that's a great point, and something that's critical, I think, to remember as well. We're going to change gears slightly and just touch on the geopolitical landscape. We are experiencing many changes in the geopolitical landscape that can contribute to uncertainty, distress, and impact our mental health in ways that we know then inevitably shows in the workplaces. So, we're talking about world conflicts and climate-related events to humanitarian crises, the rising geopolitical tensions, and these issues are increasingly present in our daily lives and constant, right? We receive nonstop news through different multiple media channels all simultaneously. They're no longer distant headlines. They are part of our daily lives. One of our audience members raised this concern and question during the registration, and I think it really reflects a growing trend that people are really feeling the weight of these global issues. And the registrant was concerned around, how this was presenting in the workforce, particularly its impact on frontline government workers who are often the first point of contact with the public. Many of them are facing increasing levels of aggression, incivility, and discriminatory behaviour. I would argue that these aren't related to just frontline government workers, but any frontline worker. So keen to hear your thoughts on how we address this. What approaches or supports do you see as most effective in helping these workers navigate such challenging interactions while also protecting their mental health?
Yeah, look, it is such a significant issue at the moment. And the first thing I'll say is, look, abuse and discrimination are just not acceptable in any setting, in any workplace, in any job, frontline or backline, however we describe that. And workplaces will need systems to support staff through this. And I think, just the way we've gone about this in the past is not going to be good enough for not just the current environment, but potentially going forward. Incivility is rising. There are growing cracks in our social fabric. The Scanlon Foundation does some fantastic social cohesion research on a fairly regular basis, and it's showing strained interfaith relationships, increased polarization, rising fear, perceived lack of safety, all of the kind of markers of incivility and divisiveness at a population level, declining social cohesion. So it is real, it is happening. It's not just imagined, and it's not just in your workplace. I think again, this really important, coming back to the basics of our responsibilities as employers, to eliminate as far as reasonably possible the psychological risks that present in any work. That there's good job design, in sufficient and the right types of supports. And that's not just necessarily an EAP. It's ensuring that you're building a culture where if people are experiencing incivility, abuse, discrimination, there are channels to report that. There are processes and systems and supports that are both formal and informal, peer support. These kinds of things are going to be absolutely essential. I think the dynamic that we often don't talk about in these circumstances is actually empowerment. There is nothing worse in a role of feeling like you've just got to do the job, stick to the script, put up with the abuse, and be quiet. Often the best solutions will come from the people in these roles themselves, the people who are going through these experiences every day, and listening to those ideas, and wherever reasonably possible, implementing them, but also empowering someone to actually understand that there are always lines, and that we are here to support you, but you also have some power in this relationship as well, in the sense of, calling out abuse and discrimination if you experience it, if that's possible for you. So I think there are a whole range of complex things. It's going to be different for every job. It's going to be different for every workplace. But I think it stops and starts with leadership and culture, and having these conversations around, okay, what's going on? How can we support you in ways that actually will be meaningful for you in this role? I wish I had all the answers. I wish I had a playbook that I could just create a link in the chat and everybody would be happy. But it's real, and we are hearing it from every angle. That I was chatting to the Australian and New Zealand Ombudsman earlier this year, and they were talking about the abuse that their staff are experiencing through the complaints process. People are fractious, they're unhappy, and they're often turning to strangers to take their frustration, their anger, and their own experiences out on in stressful situations. So it's a really tough one.
Yeah, and I think it's a good reminder, Georgie. I think there is always that, we're always talking when it comes to workplace interventions, what's evidence-based best practice, and we look to the research, and while there is a place, absolute critical place for research, but people often forget that your workplace is an evidence source of evidence, and it's
Look,
what works for the workplace.
exactly. It's when we combine that qualitative and quantitative stuff,
Yeah.
the real experiences of real people with, incredibly, smart research data. And when we combine those data and insights, I think that's when, the magic can really happen. But, a machine's not going to be able to tell you how it feels to be on the receiving end of abuse in a call center, you know? It's those people who are going to be able to come up with solutions, and sometimes just even sitting and acknowledging that and having a conversation about it is helpful.
Human-centered design, isn't it?
Mm.
Yeah, for the workplace. All right, we are up to our final discussion topic. So just a reminder, we will be opening up for some questions from the audience. If you haven't already, please feel free to pop any there in you have for Georgie in the Q&A function. We will try to get to as many as we can. So we know all of these things are happening, and while we may not be able to change what's happening around us, we do have the ability and knowledge to control systems and practices, as well as the supports offered in the workplace to help our people navigate dynamically changing landscapes. And what managers, employers, organisations need are practical takeaways and strategies and knowledge for empowering the people. So this discussion is really about what we can do to help staff members, not only in current circumstances, but also through whatever might come next into the future. So what do you see as the role of workplaces to respond to these pressures? Are workplace mental health policies keeping up pace with this dynamically changing landscape?
Yeah, yes and no. I think policies are, especially when it comes to regulations around psychosocial risks and harmonizing those are really important developments, because if we all are following the same playbook and we all have a basic understanding of our responsibilities as employers, then that's a really good thing. But I think at the end of the day, you can't curate or legislate for people's experiences in a very volatile and complex and uncertain and ambiguous world. You have to design jobs differently. I think you have to design cultures differently, and you have to have different conversations with your people in designing, what kind of workplace culture you want to build together. We don't, cultures are not dreamt up. They're not they don't just spontaneously appear. They take hard work. They take constant vigilance. It takes constant vigilance. It takes the involvement of everybody in a workplace to contribute to the kind of culture and design that kind of culture together. So I think, those are some of the things I'd say. But I think at the end of the day, we have to stop. There is absolutely some lines between, what we can control as employers, and what our legal responsibilities are, but also what our moral responsibilities are as humans and as leaders, and to remember that those lines are becoming increasingly porous. People bring their stressors to work. They take their stressors from work home. This work-life divide or balance that we've talked about for years, I just think is not a concept that is particularly reflective of the world and lives that we're living today. And so I think, really consciously leaning into that from a culture perspective in a workplace and designing policies and practices and new rhythms and codes of how we want to be as human beings in a workplace community is really the answer to a thriving and healthy workplace going forward.
Yeah, thanks. And this probably leads very nicely into a registrant question who has asked around the responsibility of employer. Where does it start? Where does it stop? Does it in regards to mental health of employees?
Yeah, look, we can only control what's in our control. At the end of the day, that's as simple as it comes. Our job, every workplace's responsibility is to provide a safe workplace, a workplace that reasonably works to reduce or eliminate those hazards that we talked about today, and to respond to people when they are struggling, to support people when they are struggling. And, we talk about the protect, promote, protect and respond. So, let's actually protect our mental health in workplaces by good job design, by good policies, by a positive culture. Let's promote good mental health at work by talking about it, by creating the kind of culture where disclosure comes naturally when you are struggling, and where you know support is going to be made available to you, and perhaps reasonable adjustments might be on the cards too. And then support, when someone is struggling, you've got to have that range of supports, both informal and formal, on offer to your people so that they can get back to good mental health as quickly as possible and stay connected to the workplace too.
Yeah. And so building on that, there was another thoughtful question that came through in the registration that speaks to the complexity of certain work environments. And this question is in the context of policing, where fatigue and occupational exposure and trauma are constant companions that you referred to earlier. How can workplaces realistically create and sustain mentally healthy workplaces when they are constant and part of daily work?
Yeah, it's a really great question. And, police and emergency services, defence forces, certain types of industries face particular challenges. And, what's going to work for, a sales organisation or a human services organisation or a office-based organisation is not going to work for, a police force. I go back to some formative research that Beyond Blue did, oh gosh, some years ago now, called Answering the Call. It was the biggest global research study of its time, and I think probably still is. We had every single police and emergency service agency in Australia work with us and their people and their people's families to actually identify what the stressors were in those particular environments, and therefore what the solutions might look like. And it came down to the things that the common things that actually still do apply to every single workplace. Job design. And again, for the police force, it's going to be so different. You do have shifts. You do have particular environments where, you're rushing into danger with a gun by your side sometimes. It is a quite a remarkable situation. But the things, so good job design, but the number one thing across all of these agencies and their families and their frontline workforces was, if we build the right environments where it's okay to talk about this stuff and it's okay to do that in a way that will result in perhaps a different job design for me for a while, but knowing that I'm not going to be held back from the job that I have worked for my entire life and have wanted to do since I was a kid. It's those kinds of, it starts and ends with culture. The one thing that we found in this research which surprised us the most was this concept of what I'm thinking isn't what you're thinking. So again, the self-stigma that police and emergency services personnel felt about their own experiences of depression, anxiety, and poor mental health, the shame that they felt around, and the fear of disclosing to their colleagues, thinking that they would be thought less of and less reliable and a less good colleague, was diametrically opposed to what their colleagues thought about that situation. I would not want to disclose, but if somebody else disclosed, hey, that's just, I'd want to be there to help them. So what I'm thinking isn't what you're thinking. And I think that's a truism that actually probably exists in most workplaces. And it's something that's worth having a conversation about, I reckon, to kind of really bring out of the shadows of like, hey, if Fred next door to you said he had depression, how would you feel about it? Most people would say, I'd want to help. And I think, there's a lot of stuff that we talk about that's really heavy and sad and difficult, but there's a lot of good stuff out there. Most people are good people.
And I think you touch on that self-stigma where we hold ourselves to such a different standard to what we hold others to as well. That's quite important. So we're on to our final registrant question before we go to the Q&A after this. This question touches, it's sort of in two parts. It touches on the long-term sustainability of mental health supports in the workplace. And the first one is, how do we shift workplace culture so that support for mental health is proactive and authentic rather than reactive or influenced perhaps by what others are doing?
Mm. So can you just help me sort of talk a little bit more about that? Because I could go
Yeah.
several ways on this.
Well, I think it's how we would interpret this question, because I think that's lots in there. So I'll read it again, and then we can look at how we'd like to frame it. So, how do we shift workplace culture so that support for mental health is proactive and authentic, rather than reactive or influenced by what others are doing?
Okay, so wow, that's again a really good and big question. Look, I think of these things simply, and perhaps some might say too simply sometimes.
Mm.
I think most people go to work and want to do a good job. They want to, there's different things that motivate people. So we all get up, we go to work, and we expect to be able to do good work, and we expect to be able to be treated with dignity and respect, and to not be bullied and harassed or treated badly, and to feel like we're making a contribution. So I think if you get those structural things right, and you get the system things right, and you get the policy settings right, and then if you nail the culture, you're going to win every single time.
Mm.
And I think if I turn this on its head, because again, I think we talk about workplace mental health often from a deficits perspective. Let's talk about the strengths that work can actually provide, and good workplace cultures can provide, good job design can provide. The one thing that I have experienced over my many years of working in this space is we ask different questions, we often get different results. So when someone is starting to experience, there's a bit of tension in a workplace, and rather than just say, oh, this is a claim waiting to happen, what about asking that person, hey, what's going on for you? How can we help? Like, is there something going on that I've done that you've experienced here? You don't seem yourself. What can I do? What can we do as a workplace to support you if that's what you need right now?
Mm.
Rather than these are the expectations of the role and you're not performing them. Quite often, if you ask a different question, it changes the entire dynamic of that relationship and that dialogue. Where often people who may be experiencing, things going on outside of work, things happening at work, are given permission, and you're opening a door for them to have a different conversation with you. It might not work every time, but it's worth a shot in my view. And at the end of the day, if you want someone to do a good job, give them a good job to do.
Yeah.
It's an oldie but a goodie, that one.
That can be the slogan for today. I like that one. All right. So we're going through the audience questions. We get to hear from them. They've been submitting some fantastic questions, Georgie. The first one is, it's building on your last comment about individual perception of harm. How do we best build resilience in the workforce?
Well, I'll take this out to the general question response that I give around declining resilience in the community is one where we've got to stop talking about resilience being an individual thing. And I will use this example. If you're a young person who is experiencing family violence, living in poverty, perhaps being abused, it is very challenging to say to that person, just be a little bit more resilient, right? we wouldn't dream of doing that. So it's the structures and the environments that we operate in, that we live in, that we work in, that we play in, that actually contribute to and often are determinative of our levels of resilience. We're all born with certain levels of resilience, but it gets chipped away at through adversity and through environments that we live, work, and play in. So again, if we change the conversation away from you've just got to be more resilient as a person, as an individual, to what's actually going on for you in the environment that you're in, is there anything that we can do to eliminate the things that actually might be driving down your resilience? That's the first thing, right? So again, it's a different conversation. At the end of the day, if you're designing, if you've got good work, if you're offering good work to someone and you've got reasonable expectations around their performance and the expectations that you would have that anybody could meet in that role because you've been clear, you've recruited to the right capabilities and skills and experience, or you provided developmental opportunities for that person, you have reasonable expectations as an employer around that person's employment. And it is okay to give feedback if that's not being met.
Yeah. Yeah. And what I'm also hearing is that importance of that shared responsibility as well, that it's not just on the individual. The other question is, some people believe that mental health concerns should only be voiced when they become severe, as speaking up earlier might negatively affect relationships with colleagues, managers, supervisors. Is that a valid perspective, Georgie?
I absolutely understand why that might be a view that people hold, and it is probably, well, it's often born out of experience, bitter experience often. I have a very different view though, and I know it's not a view that is always going to be the right option for people in every circumstance, but go back to that data that I shared right at the beginning of this webinar. People are waiting upwards of a decade before they seek support for their mental health. And by the time they do, they're reaching a point where they are extremely distressed. Extremely distressed. If we had caught and coached them to better mental health earlier, they would be better off, their families would be better off, they'd probably feel more productive in their work, they'd be living happier, healthier lives sooner. The distress, the trauma, the kind of unhappiness and the weight that is held when you don't deal with things earlier. Prevention is better than a cure. Earlier is better than later. All of these truisms have never been more true. And again, I think if we think about workplaces as a setting, if we create the opportunities and we're creating different types of support options for people that actually catch them earlier in sort of subclinical areas. So that's a technical term for before they reach sort of clinical criteria for a diagnosis of depression, anxiety, or another mental health condition, that everybody wins. Now, I've been, I was in the media a few years ago as saying, be careful about telling your boss. And I was confident saying that at that time. I think things have evolved since then, but that is not an experience that everybody will have in every single workplace. It should be the experience that everybody has in every single workplace. But I think you have to make a judgment yourself about when you speak up, who you speak up to, and who you trust with that information. I would say to anybody who's managing people, lean in, ask those curious questions, and be there to support people earlier, because again, the benefit to you, the whole team, and to that person will be profound.
Yeah, and I think that's, when you talked earlier before about the power of being able to empower your staff members to be able to make those decisions, and not only make those decisions but actually offer those options too. So services like Before Blue, which really does look at that early intervention and try and get in early, and it's not about being unwell to the point where you can't get to work, but it's at the point of if you feel slightly overwhelmed or if you feel like something's not quite right, that is the time and the place as well, so that we hope in the hope that, that an individual doesn't get to the point where that fear and that self-stigma starts to come in.
That's right. It makes no sense, does it? I mean, we wouldn't wait until we're really, really sick with diabetes or another chronic disease before we provide support and take medication or whatever it is. So it just makes sense for everything, from a business perspective, from a human perspective, from a work, a colleague perspective, to actually catch people early.
Yeah. The next question is around probably the data that you had presented earlier in this webinar around how does mental health data, Australia's mental health data, compares to other developed countries? Is Australia unique or similar? Did you know whether there's any research around that?
Look, I'm not going to say with confidence this, because to be honest with you, I haven't got that data in front of me. But look, what I will say is that Australia tracks pretty similarly to other developed countries in terms of prevalence. We're considered, it might not feel that way because our mental health system is challenged and challenging for many, but we are considered to be world leaders, for example, in digital mental health solutions in terms of, new models of care, emerging models of care. So compared to many countries, we actually are doing pretty well when it comes to the systems and supports and policies that we have in Australia. The fact that we have bipartisanship for mental health in Australia is not the same for other countries. But in terms of the prevalence, look, we track pretty similarly to other countries like Canada and the UK, New Zealand. In terms of suicide rates, we don't do as well as we should compared to the global rankings. And we've seen some countries really improve their suicide rates, whilst Australia's suicide rates for the adult population have actually been stubbornly static for the last couple of decades.
Yeah. Thank you for that. The next point we have is an audience member who is appreciative of having this conversation, candid discussion on the impact of the cost of living crisis and geopolitical uncertainty on mental health. And the audience member writes, I believe that the increasing stressors you mentioned, plus the increasing cognitive or perceptive overload that people are exposed to, due to everything being quicker, louder, more colourful, and the stress due to increased cognitive overload from increasing technological complexity, all increase cortisol, which is our stress hormone. And that shifts the brain from the rational system to perhaps working or responding more instinctively. So what I'm interpreting that is that rather than thinking through a reaction or a response, because we're also heightened and we're in that state of that fight and flight, we just moved to that primitive part of the brain that just reacts instinctively, which makes it in turn for people to drift into incivility. What do you suggest we can do to specifically counteract this effect?
Yeah. Oh, that's a great and big question again. I really love these questions. Look, there's so many different layers to this question. I think it starts in our local communities, actually, and workplaces are actually a community. We're celebrating World Mental Health Day tomorrow, and the theme of this year's World Mental Health Day is connect with your community. And I've spent a lot of time in the last 48 hours talking about the power of community. Most mental health care happens outside of hospitals and health clinics. It happens in schools, it happens in friendship groups, it happens in online communities, it happens in footy clubs, it happens around the kitchen table in our families. The power of community to protect us and to bind us and to counter division is incredible. And if we as a community give up, and as humans we give up, and we don't find those safe harbors to keep ourselves feeling like we have hope and connection and support, then the world will be a dark place.
Mm.
So I think, my advice to everybody and to the person who's asked the question is just remember the importance of community, whatever that looks like for you. For me, it's walking the dog and hanging out with my friends, right? And partner. It's doing jigsaws. It's crazy things like that. But at the end of the day, the world that we're living in, the sensory overload that we're experiencing as humans is all of those things that you've described. It stresses our nervous system. And the way our brain responds is often, in a physiological way, is to actually make us turn inwards or against each other rather than actually outwards and with each other.
Mm.
It's a classic primitive brain response. So that's what many of us are experiencing at the moment with this cognitive overload, this burnout, with this high stress environment that we live in. I'm going to go through some things that are absolutely grounded in evidence. Please don't roll your eyes. They are absolutely grounded in evidence. They may seem like little dots in an ocean, but at an individual level, they can be incredibly helpful at times of overwhelm. And those are things like mindfulness and breathing techniques. Just stopping yourself in a moment and taking 3 deep breaths changes your body, changes your thought pattern, stills your mind, and just shores you to kind of lift and keep going. Change your environment. If you're finding your environment very overwhelming, maybe just stepping away, going for a quick walk, walking even around the office can be helpful. Find out what works for you in terms of stress management. It's going to look different for everybody, but most importantly, don't forget to breathe. Breath is so important. The other thing I'll give you is jump on the Beyond Blue website. We've got a highly evidence-based personal wellbeing plan tool on that, which we're about to digitize. It's not quite ready for launch yet, but we want everybody to have a personal wellbeing plan in their back pocket on their device. It's grounded in evidence, but also co-designed with people with lived experience of depression and anxiety. It'll help you design your own wellbeing plan that you can pull out and look at and just make sure you get through those really, really tough moments. I wish I had the playbook that I could put the link in the chat. But I think if we come together in our communities and we give hope and we shore each other up, that's where hate can be overcome. Mm. And where we can protect our well-being at a community level and also at an individual level.
Thanks, Georgie. And I think you raised 2 points there in that, the strategies that you have suggested are actually very well researched. And especially, I think it's important to remember that stress is a physiological response. So some of the things that you can do is actually to alter and change that physiology, which is what the breathing and the mindfulness can do. Another thing that I want to touch on that's really great to hear you talk about it is that there's a reason why social networks is one of the biggest protectors of protective factors for well-being, right? And that's the community that you talk about in whatever way or shape that looks like as well. Thank you. That was an extremely thorough and thought out response.
Was it? Thank you. It's very kind of you.
So the next question is a bit shorter, but do you have any stats or any personal opinions around whether it's based on anecdotal evidence or your experience around the true effectiveness of EAPs?
Look, EAPs are incredibly helpful services for many people. And EAPs are evolving as services. Some of the design things that I think, need looking at are when we access an EAP, it's often when we're really quite unwell. And there's a single session or, a few sessions and hopefully it works. I think there's very low uptake of EAPs generally across workplace populations. And I think we should have a conversation about why. Why is that? Is it a trust thing? Is it I don't know, is the design of the service right? I think that from an employer's perspective, and this is my opinion, but it's also my experience, is that I want to know that if people are going to REAP, that they're actually getting better. I don't want to know who they are. I don't want to know their presenting issue. I don't want to know any personal information, but I want to know that that service is having a positive therapeutic impact on those people who are presenting to it. And I think, like many services in the mental health system, they're designed as that they're outcomes blind. They're not measuring and routinely reporting back to the person and to their employer at an anonymous aggregate level recovery data. So does this service make people psychologically better? So, look, I will do a bit of a plug here, and you did mention it earlier, Marion, is one of Beyond Blue's workplace services called Before Blue, which is it's not competing with EAPs. It's actually a very different service, and it can sit really well alongside an EAP. But what we're trying to do through Before Blue is to, as I said earlier, catch people earlier and coach them to better mental health. So we want people to not wait until they're reaching a point of extreme psychological distress before they turn to an EAP or another type of mental health support. We're wanting this to be a very, very big open door to anyone who's starting to experience and to help them manage work and life stressors, to build strategies that help resilience, that improve productivity, that keep people at work, enhance job satisfaction. Highly evidence-based. We've had community models that we've been operating in Australia for over a decade, supported tens of thousands of people with about a 70% recovery rate in the community. But look at the results that we've seen through Before Blue. 9 in 10 people are experiencing a clinically validated improvement in their mental health, in their productivity, and importantly, we're teaching people skills to cope with mental health challenges going forward should they occur again. We match you with a coach. And we do an assessment of what's actually going on for you, and then you work one-on-one with that coach, with the same coach over 8 sessions, 1 assessment session, and then up to 5 coaching one-on-one sessions, and then a session at 1 month, and then a session at 6 months. So 8 sessions in total. And we coach you using cognitive behavioral therapy techniques, so highly evidence-based. We coach you about how to look after your mental health, how to overcome those work and life stressors that you might be experiencing. And what we do is we share with you at every single point of contact between you and your coach your recovery data. So you can actually see how you're improving psychologically. This is the kind of design that I think is really interesting. It's no barriers to access. It's non-stigmatizing. It's not, it's designed to feel different to a traditional mental health service. You work with the same coach, as I said, over multiple sessions, and people love it. We're working with Comcare. It's available to APS agencies. And, we're growing in the number of agencies that are wanting to work with and commission this service. So if you are interested, you can head to that link on the slide and check it out, and contact my team and see if it's the kind of service that your workplace is interested in commissioning.
Thank you, Georgie. I think there are lots of benefits for that program, and it really is about, if we think about, I think it's critical time to think about that broader ecosystem of support where there is a role for EAP. There's there are a myriad of other support services that employers are offering these days, and where does Before Blue sit in that? Where does EAP sit in that, and along that continuum as well? Well, that brings us to the end of today's session. Georgie, on behalf of everyone who attended this afternoon and myself, I'd like to thank you for your time. It was an invaluable discussion. I'm sure everyone here has taken away some important learnings from your insights and experiences. You've reminded us all that although there are numerous external pressures beyond our control, and there always will be, but workplaces do play such a powerful role in shaping systems, support, and culture. And so, as we wrap up today, we invite you to take what you've heard and hopefully turn them into action. We hope that these conversations today sparks future conversations with your colleagues and your teams, and reflect on your systems, share insights and new ideas, and together let's keep fostering mentally healthy workplaces and psychological safety every job, every day. Thank you, Georgie, again, and to the audience for taking the time to join our session, as well as your energy and contributions to the discussion. Before you log off, though, I would like to share some few upcoming activities and events that you can participate in. Just, I think, a segue from Georgie mentioning the Before Blue program. If you are a Commonwealth employer and you would like to find out more about this program, we are hosting an information session for Commonwealth employees on the 22nd of October. Please reach out to forums@comcare.gov.au for more information. And in addition to our upcoming Safe Work Month webinars I mentioned earlier, we have some training courses we are offering on psychosocial risk management available, as well as our brand new course on workplace trauma, your legal role. This is more information on there's more information on the screen now, and also in the pinned post if you were interested in finding out more. And finally, a short survey will be landing in your inbox shortly. You can also scan the QR code that's on your screen at the moment and click the link in the pinned Q&A post to complete it now. It takes a few minutes. It really helps us shape future sessions. These are for you and what you feel the needs are and how we can continue to build that knowledge and insight. If you'd like to revisit today's session or want to share it with your colleagues who couldn't make it, the recording will be available on Comcare's website soon. Thank you again for joining us. Take care, stay safe, and we hope to see you at the next event.